Hi, Jenny here. Today is Thursday, October 26th. So I thought I would give an update. I had seen the surgeon yesterday and my regular doctor today. Not wearing any makeup because I figured I would just cry it all off. This is not the update I thought I would be giving. On Monday, I got the MRI results in my computer account, my Livewell account, and it said on there that the tumor has not shrunk at all. So that was a surprise. It's kind of shrunk. It's kind of shrunk vertically, but it's grown widthwise. So it went from a 9 to a 7, but it's grown like from a 5 to a 6. So according to the paperwork, it basically says it's grown in mass. Good news being that they couldn't see that it affected any of the lymph nodes. My lungs are fine, my liver's fine, all my other organs are fine. So it's just that it's still in the rectum and kind of going outside of the actual rectum wall. I think it's into the mesentery, I think that's what it is. And it's perforated the vaginal wall, which I had kind of expected. I know when it was first diagnosed, it said it was up against the vaginal wall. And then around the 4th of July, when I had had some output coming out the vagina that kind of seemed period-like, that I had a feeling that that was a perforation. And then I had the leakage happening again, which seemed more like mucus coming out, but there was still stuff coming out of the vagina, so I had a feeling that the wall had been perforated. How much it affected, I wasn't sure. So I saw the surgeon yesterday. I got a call from the doctor's office the day before saying they needed to change the appointment. And I thought, oh my gosh, here I just got these results on Monday. And although I already wasn't looking forward to the appointment itself just because I had to do a couple enemas beforehand and I wasn't looking forward to that, I'm more nervous about that, I think, and stuff. But now that I got these results, I just felt kind of deflated. I felt like kind of really punched in the stomach type of thing, but I was just blah. I'm like, okay, well now what? So looking forward per se to hear what she had to say about what's next. So in any case, they called to change the appointment, but they could get it in the morning. They couldn't do afternoon appointments, but she was available in the morning. I still had the Gynecological appointment at 2 in the afternoon. So the appointments in the morning, I took 9:30 was the latest, and I thought, well, that way we're going to sit there for 4 hours or something, but so be it. It's okay as long as I could still see her. So yeah, I tried doing the enemas beforehand, and I couldn't get the enema bottle really in at all. I'm just trying to squeeze the water, and the water wasn't going in. So disappointed in that, just because, again, something, doing what I'm supposed to do this to make sure it's all cleared out in there so she can see clearly when she scopes me. But I tried. That's all I could do. So we got to the surgeon office a little bit early. She took us early, so I guess the appointment before us probably wasn't taken. So they got us in the room early, and then I mentioned to her that I said, well, I'm sure as you could see of having a look at the scan results that it says the tumor hasn't shrunk at all. And she said, yeah, I'm surprised. So that's not really good that she was surprised too. So this doesn't happen often, I guess, that the tumor doesn't shrink. And she thought that it was going to shrink by half. That's what I was expecting, that it was going to go down to like a 5 or, again, that the treatment that we were doing worked. I guess that's what I'm feeling. I'm like, all right, we did the chemo, we did the radiation, we did the protocol, and then, we didn't want to be having, prayers. I'm doing visualization, and to have none of that really work per se. I can only think of that all of this kept the tumor at bay. It just kept it at least kind of the same size, so it didn't grow. Doctor didn't really say anything other than, that she was surprised that it hadn't shrunk at all. And then I said to him, at least I'm feeling good. I don't have any other symptoms. I feel fine. I can still, walk. I can still do stuff like around the house. I can do stairs. I'm not having troubles, breathing or walking or pains anywhere else. I just have pain in the rectum. She didn't say anything about that. It kind of seemed that it, if anything, that was a plus. And I said, at least the cancer still, according to this, what I could tell, it hadn't spread. Like I said, it hadn't spread to the lymph nodes or any other organs. So again, that's a good thing. And she said, well, let me take a look and see what I can see. And so I had to lay down on the little exam table they have there, and she put a finger at me, and I was like, ow. And she goes, well, is it painful or is it just the pressure? I said, no, that was painful. And I think she moved around. She goes, okay, well, what about here? She's like, I could feel the tumor. And then she moved her finger and put pressure in a different area. And I said, well, I can feel pressure. I feel a tiny bit of pain, but nothing like the other area or whatever. And she's like, okay. And then she's like, I'm sorry, I don't want to hurt you, but she's like, I just want to try the scope. I said, I want to see. And I'm like, yeah, it's fine. And it was kind of cute. The nurse navigator that was in the room, she was holding my hand during this. So the doctor put the scope up me, and she goes, well, if you want to take a look. And I could look down, and I could see the screen, and I could see the pink, healthy sphincter tissue, but then the tumor was right there. She's like, yeah, this is the tumor. She goes, unfortunately, I can't save the sphincter muscle at all. I said, okay. I go, so that means that I get a colostomy bag for the rest of my life. Which, again, I knew was a possibility, but I really didn't think that was going to happen. I thought everything was going to be fine, and should be able to reattach, take the tumor out of the rectum and reattach the intestines and then do the bag reversal. So, kind of 180 degrees of what I was, thinking going in. But to have her say, okay, she can't do that. So then she had me always all put together, whatever. So then she had a little drawing. And she showed on there about, okay, where, on like an intestinal drawing. They showed you that drawing she'd done before, but it has the rectum circle. Look at the tumor is there. It kind of goes outside the rectum wall. Then it goes back towards the tailbone. And in fact, she doesn't even know she can get it all because of how far back it is. And if she can't, she's going to put 3 little markers in there, like 3 little BBs or something, of where they'll know to do radiation, so that I may have to go through more radiation. So that'd be her part, and then she said, and then there'll be, so I said, so then you're going to sew my butt shut while we're doing, going the whole operation and while I'm still in there, and she said, yeah, there'll be a plastic surgeon who does that portion. And I guess on what they do is they use an abdominal muscle. So somehow when they're in there, they can cut, muscles are usually long. And so they'll cut the top part of whatever muscle and fold it over so that'll go down, and then that'll cover up the anus portion and sew me shut. And then I said, something about the vaginal area, and she said, well, that the other doctor will talk to me about that and what she's, her plan is for that. So that was about it. She, she apologized. There's nothing they can do. And she left, and then the nurse navigator I was still there, and she was like patting my shoulder, and she's like, I wish I had some words to tell you that would make it all, all better, make you feel better. But it's a lot to take in. So then, because we had that appointment at 2, I asked when I signed in if by chance we could see that doctor early too, which is why, we could stay there. The other doctor said, yeah, she'd try to squeeze us in between other patients, and that they had to switch rooms just so they could clean up that room, be able to use that, put us in a regular room. And then the physician assistant came in, talked with me a little bit, or talked with us. Wayne was there too. Asked about different surgeries I've had. So basically all I've had is a C-section and then the surgery for the ileostomy. So I guess they know what kind of the scar tissue and that would be in there they're dealing with. And I think that's about it. I mentioned the output that I'd been having or whatever, but she said, okay, she's not sure if the doctor's going to want to do a hysterectomy or not or whatever. And I thought, well, that's interesting, because again, the MRI results were showing that the uterus and the fallopian tubes weren't affected at all. So, in fact, that was one of the things I told my husband when I saw those results, was like, well, at least I'm not going to need a hysterectomy, because those are fine. The doctor came in, and she was talking to us and said, yeah, so the tumor is along the whole back side of the vaginal wall or something, so they're going to remove all that, and also a little bit of the top of the vaginal wall, so they're going to, it's touching the cervix, I guess, so they're going to remove that. And then while they're in there, because I don't really need the organs per se, they're just going to do a full hysterectomy so that they'll make sure that they get all the cancer cells, that there won't have been anything that have spread, and there won't be a chance of those organs getting cancer. So yeah, surprise. I was not thinking I'd have that done at all. Again, thank God I am, 57. I've already had my children, them being in their 20s, so I don't need my uterus. I don't, not planning on having any more kids. But even still, that's still a thing of knowing that stuff is going to be removed. And then I asked how they rebuild, the vagina, with taking out a portion of it. I'm like, do you just sew the parts that are left together? And she said, well, with the plastic surgeon and how he takes that muscle out and he brings it down for the anus part, that actually can go down along the back side of the vaginal wall, and that'll take care of that area. So it'll sew that to the muscle. And then she asked if the doctor had mentioned if the surgery was going to be robotic or not. And I said no, and she said, okay, it'll probably not be. They'll probably end up cutting me open, which again, no real big deal. I'm not a model. I'm not out there, in my bikini. So that's not really going to matter. Scar tissue, but it's still a bigger surgery than being able to, 5 little cuts, they'd be able to go in and do stuff, but they're going to have to cut me from my belly button down. And the gynecologist had mentioned that that'll be easier for the plastic surgeon also, as far as for everything that they're having to do to me with taking out the rectum, taking out the uterus and all that. And I said, with the uterus out of the way, it also makes it easier for him to be able to get that muscle he needs and fix me up the way I need to be. I had asked the surgeon how long the hospital stay would be. She says minimum of 3 days. They're also looking at probably having the surgery on a Friday. They had scheduled me for Thursday, December 7th, but they're going to bump it a day because the plastic surgeon doesn't do surgeries on Thursday or something, so they're going to bump me a day, trying to get that scheduled. And so I'll be in the hospital then, obviously, so Friday, Saturday, Sunday, Monday I'll meet with the wound care ostomy nurse to make sure that I know what's going on there, that I know what I'm doing, which isn't going to be too much different than changing the ileostomy bag. I believe it's just going to be maybe a little bit of a bigger hole. Don't know if the ostomy bag is going to be on the left or right, depending on, I guess, the muscle that the plastic surgeon is going to use. Will depend on where they're going to put the colostomy bag. So that was about all that what happened yesterday. So lots of tears yesterday and today, still processing it. Like I said, it's just disappointing with everything I've gone through. And I said, having all your prayers, prayers from all the family, myself praying, meditating, sending healing light, and to have it seem like it hadn't done anything, that it didn't work. And it's like, well, what do I do now? There's still a month. I still have the whole month of November to go through with nothing per se. I know the surgeon did say like the radiation is still working, which is also why they'll still wait. They're not going to bump up the surgery or anything. They want to have that 8 weeks after radiation so that the tissue will be healthy enough that they'll be able to, operate on it, and that it'll stay and it'll be good what they're doing. So that makes sense. I asked her about the pain level, why I would have little flare-ups and pain, and she said the tumor may be pressing on some nerves here and there, so that I may be having pain that way. If I do have the pain, to just make sure, yes, go ahead and use the tramadol, and if the tramadol ends up not working, to let them know, and they'll get me something that does work. They don't want me to be in pain, which is nice. So I kind of confirmed like who is my go-to doctor at this point, because of the whole kind of mix-up with the tramadol. And she said, well, really my oncologist should still be my go-to. And especially anything that is, kind of either cancer related or, going on with the body, but anything regular type stuff, I can go to my regular doctor, like a cold or, whatever. But so that was that. So it was nice we got out of there earlier yesterday, so we didn't have to hang around for the 4 hours. So again, that was good. And then yeah, we were able to come home earlier in the day, so that was okay. Today I saw my regular general physician. It was supposed to be the pre-op visit. I got a call today, an hour before my doctor's visit, saying that they're working on the surgery date. And by the way, she saw in my chart that today was supposed to be like pre-op work, and she goes, it's too early. You can't have it done yet. It needs to be within a month of surgery. And that's what I thought. When the guy called and wanted to schedule the appointment, I asked him that. I'm like, isn't this too soon? Isn't this too, like, way far ahead of time? I thought I would think you would want it closer to surgery time of, like, I don't know how much the body can change in 6 weeks, but it can. So, and he's like, well, that's just what my instructions are to get this. And I'm like, okay, fine. I thought, well, now it's an hour before my appointment. I can't really call and cancel my appointment. It's like, this will charge you or whatever and all that too, or it's inconvenient. So I thought, whatever, I'll just go. They supposedly wanted to do a physical, my annual physical or whatever, and that too, and we'll just talk about the pain medicine or whatever, and again, what her role is going to be through this. So I had that appointment, and I know the nurse and all that too is like, oh, we're going to do a PAP on you today? I'm like, yeah, no. The gynecologist yesterday too said that, she was like, yeah, I'm not going to go inside you, knowing what Dr. Myers had said and knowing that, what we're going to have to do. She says, I'm not going to, look at you and stuff. I thought, good, thank you. I don't need anything stretched out or, whatever. So today, I told the nurse, I said, no, I'm not having a PAP and I'm not having pre-op. And she was like, oh yeah. So then, like 5 minutes later, so you're here for pre-op? And I'm like, no, I can't have that. It's too early. And, oh, okay. Well, so she put whatever notes in, and then the doctor came to see me, asked how I was doing, and I was just kind of nodding my head, and she was like hanging in there, and I still, kind of started crying. I said, well, I don't know if you looked at the notes or not. I said, but I did just meet with the surgeon yesterday, and I said the tumor has not shrunk at all. And she was like, really? And I said, yeah. The surgeon was surprised also, and so I said, I'm just kind of sad. And she goes, well, yeah, obviously. Who wouldn't? She's like, I would be sad and angry and all that too. I'm like, I'm not angry. I'm just kind of sad and defeated. For the moment, I'll get back to my more positive self in a few days, but first I gotta process all this, I guess, and grieve and cry. And so in any case, she had mentioned about doing a PAP, and I said, yeah, no. I said, they're gonna remove all of that, and she said, okay, well, that's good to know. Because she was thinking that, okay, I have cancer down in that area. She wanted to make sure that she did get a PAP in to see if it had spread to the cervix, so that as long as they were in there, if need be, they would, have to take that out and stuff. And I'm like, yeah, they're taking it all out now that. And she was like, okay, well, that's good to know. So she was just trying to think of all possibilities of what, could happen, what would need to happen. Still did the other parts of the physical. I had a breast exam done. She scheduled a mammogram for me, or put the notes that I needed one scheduled. Because it's been a few years since I've had that done too. And did the checking of the ears and the mouth and the chest, listening to my lungs, and that's all fine. Talked about pain management, and she said that I guess they've kind of agreed that she's going to be the pain management person. They kind of like to have one person, I guess, just because of these being kind of opioid type things, and so they don't want you going to multiple doctors and getting multiple prescriptions, which makes sense. So she said she's going to have to, she'll have some paperwork for me to sign off on, kind of saying that I know these medicines are only for me, and I'm not going to, sell them or give them to other people or whatever. So then I asked her, I said, okay, so I was also told by the gynecologist that for 7 days before surgery, I can't take any Advil. So my husband asked, he's like, well, can she take Tramadol? And they said yes. So for the week before, I'll have some form of pain management. And so my doctor, I told her that. And I said, so I may or may not need more. And so then I'm going to be calling you. And she said yes. I said for the next month, I'd also mentioned to the surgeon, I'm like, am I going to have pain? Is that kind of like, you deal with this, all the time and know what people say? I'm like, will the pain maybe increase in this next month? And she said, well, it could. It wouldn't be unreasonable that it might happen, but hopefully not. Hopefully that everything's just going to stay the way it is right now. But in any case, so my doctor today was like, yeah, if you need pain medication, go ahead and take it. And if it's not working, let me know so that I can get you something that'll work. So there's multiple choices out there of pain medication that you can take. So we're just going with the Tramadol right now because it's working for you. And so I have that. So that's good. Other than that, she said I don't need a chest x-ray because I just had the CT scan done, and I don't need the EEG because that's good for a year, and I had that done in like February, March, I think February. So that's all okay. So all I need is blood work. And I said, well, can you just put like that order in and I can just come in and have that done, or do I need to see you again? She's like, oh, you need to see me again so that I can look at the test results and I can, make sure things are okay, that you're still healthy enough. Which, I'm like, I'm seeing you now. I have to see her again in 2 weeks. So we made that appointment. So November 13th-ish or something, I'll have to see her again. And before that, anytime after November 8th, I can go in and then just get the blood work done. And then that'll be all I need for the pre-op type part. And then she was saying, then just as far as making sure I'm kind of healthy enough for the surgery, to just make sure that I keep walking or doing some form of exercise or both, to keep the muscles strong and going so that I'm healthy beforehand, and the body will be able to heal better, faster, whatever afterwards. So I still have neuropathy in my feet. It seems to have really even gotten worse in the last week or so, that it's always there. I feel it when I stand up and even just regular walking. When we take our little walk around the neighborhood, I think like halfway through, it really starts feeling numb. Kind of like you're out in a really cold, 0-degree day type of thing, and your feet are freezing up, or, and then you come in the house and you kind of have to thaw out. Yeah, that happens to me about halfway through our walk or so, or 3/4 of the way through, and I'm just really paying attention to my walking and my steps to make sure I don't fall. So she said, yeah, try to either keep up on that, or if I could do a bicycle or do a something. I'm thinking, well, I don't really have that in the house, and I'm not gonna go to a gym just to do a bike, but so I've got some weights. I could try to do some exercise. I don't know about as far as doing squats or any of that type of thing. As with my butt hurting, I don't know how possible those type of exercises are, but I can try to do some weights with my arms and whatever, but keep those muscles going. And I said, and then I know the nurse navigator mentioned as far as protein, just to kind of try to increase my protein a little bit this month to also help with the muscles which will help with recovery. So to pay attention to that, because my doctor today asked whether I'm working with a dietitian or not. And I said, not really. I've talked with one a couple times, but because my weight is holding steady and I have an appetite and I'm eating, that there's nothing really to kind of work on. So that's my update. That's where we're at. I don't know how this next month is going to go. I still appreciate all your prayers. I will still take prayers. So please keep me in mind. I appreciate that. That's about all I can do. Still keep praying for myself. Yeah, I gotta still try to stay positive. It's all gonna be okay. I feel, even mentally, even though I'm sad and whatever, I feel like it's gonna be okay. Everything's gonna be okay in the end. I'm gonna get through this. So, just one day at a time, right? My mantra forever of one day at a time. That's how we're gonna get through this. So that's it for me for today. See if I have an update next week, because next Monday I'll be meeting with the plastic surgeon, so he can explain his whole part on what he's going to be able to do. So I might give an update after that. But so again, you never know when the next video might be. But that's it for today's. So I hope you are all well. You guys keep it positive. Go make it a great day. Bye bye.